Okay, thank you very much, and good afternoon and welcome. My name is Dr. Wachira Murage. I'm an obstetrician and gynecologist. And in this era of COVID-19, I would like to reassure our pregnant mothers so that they do not feel left behind in this era of COVID-19. And just to be able to tell them that they are safe, you'll be able to take care, give them good care, antenatal, and they should not fear. Generally, when you're pregnant with this COVID-19 season, there is no much difference other than being able to take care of yourself, just like anybody else. However, I'll mention a few things that you need to do. In the antenatal period, you need to be able to go to the clinics, because clinics is where you get your usual advice on pregnancy. There is a tendency that in this era of COVID-19 to forget other diseases like hypertension, weight gain, baby not growing, and all other usual antenatal complications. So make sure that you visit your usual antenatal clinic provider. If not, sometimes because you are far or you are locked down somewhere, it is important to remember that you can use even telemedicine. In Savannah Healthcare, it's available. We can be able to communicate with you and be able to advise you. And also, in the antenatal clinics, we have made them very, very favorable, because what you need to do as you come into the antenatal clinic, there is the usual screening of temperature, there is the usual washing your hands and sanitizer and putting on a mask. As soon as you're in you're observed by your nurse at the triage, then there is the usual protection. The nurse will make sure that the services are well sanitized and everybody is in some protective gear, the mask, and they are observing all the other measures that you're supposed to do according to the Ministry of Health guidelines. And once you're in the waiting lobby, there is social distancing. So you are well labeled the antenatal lobby where you are going to stay, so that you make sure that you keep a distance and everybody in a mask. As soon as you enter the doctor's office, then you sanitize your hands and you keep a distance between you and the doctor. And after that, after examination, is the usual sanitizing, and all goes on very well, and your clinic attendance is well taken care of to prevent COVID-19. Sometimes we may have mothers who come in and we suspect that they could have COVID-19 because of the symptoms that they may show. We're doing temperature, we have issues of cough and sore throat, history of travel, history of contact to a person who is positive with COVID-19. In case we suspect that one could be having COVID-19, we have all the channels to make sure that you are quickly tested and make sure that you are not having COVID-19. For the ones that will be positive or have been found to be positive, then they're studying for isolation, which is pregnant mother sensitive, so it's two areas, and MOH guidelines, the Ministry of Health guidelines, are well taken care of. So do not worry. In terms of you being pregnant, and I'm sure the question of how safe is your baby in case I get COVID-19, the baby is very, very safe. And you're saying there's a placenta barrier. Okay, a few studies here and there in the world have come and said, oh, maybe the baby is infected. But we can assure you that when you're pregnant, your baby is well protected. There are medications for the mothers who turn positive for COVID-19. And the medications are available with the doctors. We have hydroxychloroquine, we have azithromycin, and all those medications can be treated, the mothers can be treated to ensure that they do not have critical signs and symptoms of COVID-19. The ones that are very, very sick, then there is ICU care, and the doctors, the specialist doctors, are available to ensure that everything is taken care of and a safe delivery can be instituted. Let me say that there are no clear-cut guidelines to say that because a mother has signs of COVID-19, they should be delivered early. That is not true. What we are doing is that there is no need to induce a mother, there is no need to rush to doing cesarean section unless there are other usual standard indications of a cesarean section or reduction. mothers are advised that things will be followed very well to make sure that you get a safe delivery. When it comes to delivery, we treat mothers who are negative the usual way, and we keep the distance. We make sure all the guidance are followed, including sanitization, the way we dress, the mask, the social distances in our labor rooms is all observed. For the mothers we suspect, then we have special delivery units and also special operating theaters are made available for mothers who we suspect or who are positive for COVID-19. In case those ones are not available immediately, because some mothers can come as an emergency, and then they're coming to the hospital, then they're suspected of COVID-19 or are positive for COVID-19, what we are doing is to make sure that a theater is quickly available for the emergency, or the delivery room is available for the emergency, and then after that, the room is fumigated and made sure that it is safe for the next user. When it comes to breastfeeding, mothers, don't worry. Let us be ready to breastfeed our babies, because the breast milk is best. It has so many advantages. It has not changed with COVID-19. Mothers, we need to breastfeed and ensure that our babies get the milk that they need. When the babies come, in case the mother is COVID-19, we can be able to screen the babies. Sometimes you can screen routinely for the mothers who are COVID-19, but in most cases, you screen the babies if they have the symptoms. So there should be no panic in this era of COVID-19. The care will be good, the care is already good, and ensure that you follow your clinics and get safe delivery, and ensure that you have healthy babies. Thank you very much.